Hi, I'm Dr. Steve Schechinger, orthopedic surgeon at OSMS. The treatment and management of pediatric fractures can be much different than when working with adult injuries. So today, I'm going to review 3 facts about fractures in children. Children's skeletons are still growing, which introduces a different strategy to managing their fractures. Pediatric fractures tend to heal much more quickly than adults, and the bone has a higher capacity to remodel. This means that fractures in younger children can have much more angulation and still tend to straighten out as the child grows. For these reasons, most pediatric fractures can be managed conservatively in a cast rather than needing surgery. The growth plate is an area of a child's bone that adds length to his or her body as they grow. Growth plate fractures are unique to pediatric patients. Overall, growth plate fractures are estimated to be responsible for about 30% of all long bone fractures. The most common locations of fractures in children are in the upper extremities. In fact, the distal radius, or wrist, and then the distal humerus, or elbow, are the most commonly fractured areas. Growth plate fractures are most likely to occur during periods of growth or growth spurts, as this is when the cartilage is weakest. The risk for fracture also increases with age, and boys are much more likely to sustain a fracture than girls. Trauma from playing or participating in sports accounts for the majority of pediatric fractures. Injuries to the growth plate that are not managed properly can lead to early closure of the growth plate and significant growth abnormalities. The bones of pediatric patients are more porous than mature bone, placing them at a greater risk for compression fractures, which are also known as buccal fractures. These occur when one side of the bone is compressed, forcing the other side of the bone to bend slightly. The increased flexibility of pediatric bones makes them more likely to bend rather than break. A green stick fracture occurs when a bone bends and partially breaks, but the fracture doesn't extend through the entire width of the bone. Another common pediatric fracture is an avulsion fracture, where a ligament or tendon pulls off a piece of bone. This is possible because pediatric ligaments and tendons are proportionally stronger than their bones. The last type of pediatric fracture that we'll go over is called a toddler's fracture. This is a spiral fracture of the distal tibia in the lower leg. It most commonly occurs from low-energy trauma that typically includes a rotational component. For example, if a child's foot gets stuck while going down a slide and they twist their leg. One symptom of this type of fracture is a child refusing to put weight on the affected leg. There may also be localized tenderness, swelling, or warmth. Treatment is typically long leg casting for 5 to 6 weeks to ensure proper alignment while healing. Pediatric fractures are a common occurrence. Fortunately, with appropriate management, most of these injuries will heal well and the children can resume their normal, active lifestyles.